What happens if you don't clean your teeth for 1 year? Hey there! Have you ever wondered what would happen if you stopped cleaning your teeth for an entire year? It sounds wild, right? Well, today we're diving into what really happens inside your mouth when oral hygiene is forgotten for weeks, months, and a whole 12 months. Spoiler alert, it's not pretty. Stick around because what you learn today might just save your smile or someone else's. Let's get started with the ugly truth. So you start skipping brushing and flossing. What's the harm for a few days, you might think? Well, here's what actually happens. Just hours after skipping your routine, food particles, saliva, and bacteria start working together to form a sticky film called plaque. Without brushing, this plaque stays on your teeth, especially in hard-to-reach areas along the gum line. You won't feel it immediately, but the bacteria and plaque are already hard at work, producing acids that attack your enamel, the protective layer of your teeth. Ignoring this for even a couple of days is like inviting an unwanted guest to a party inside your mouth. And the worst part? They don't leave on their own. Now let's imagine this party going on for weeks. After a few weeks, something more troublesome happens. Plaque hardens into a stubborn substance called tartar. This isn't something you can remove with your toothbrush anymore. Tartar clings to your teeth like cement, forming yellowish or brownish patches. Worse yet, tartar becomes a breeding ground for even more bacteria. By now, your gums probably feel sore or even bleed when you try to brush. This is the beginning of gum inflammation, also known as gingivitis. You may not notice it right away unless you look closely, but your gums are quietly suffering. Think of tartar as the villain that's setting the stage for something far more destructive. Fast forward to the 3-month mark, things have escalated. With tartar firmly in place, your gums are in a constant battle against bacteria. Here's what this could mean for you. Swelling and irritation, your gums look red and puffy. Bad breath. Ever wonder why you can't mask it no matter how much gum or mint you chew? That's bacteria at work, producing sulfur compounds. Gross, right? Early tooth decay. Look out for dark spots or sensitivity. This is where cavities might begin. At this point, you might start feeling discomfort or noticing that your mouth just doesn't feel right. But things are only halfway through the downward spiral. By the half-year mark, your oral health is in serious trouble. Gingivitis has likely progressed to the next level, periodontitis. This is a severe form of gum disease where bacteria destroy the soft tissue holding your teeth in place. Imagine your gums pulling back from your teeth, creating pockets where bacteria hide and attack deeper surfaces. Here's what can happen at this stage. Bleeding gums become common. Even biting into soft food could cause bleeding. Loose teeth, because gum tissue is receding, teeth may feel wiggly. Pain and difficulty chewing? Eating your favorite foods might not feel so great anymore. And let's not forget, bad breath is now permanently part of your life. By now, many people would call a dentist. But if you don't, this brings us to the 1-year disaster. Here's the moment of truth. What happens after a full 12 months? Get ready, because it's not a pretty picture. Extreme tartar buildup. Your teeth will look yellow, brown, or even black in places. Severe gum disease, advanced periodontitis. The bacteria have destroyed your gums and may even start attacking your jawbone. Yes, you heard that right. Your jaw is at risk. Tooth loss. Without support from healthy gums and bone structure, your teeth might literally fall out. Abscesses and infections. Pus-filled pockets form in the gums, leading to pain, swelling, and the risk of infection spreading to other parts of your body. And this is about more than just your mouth. Oral health is directly linked to overall health. Poor hygiene can increase your risk for heart disease, diabetes, and other systemic conditions. So skipping that cleaning hasn't just damaged your teeth, it's put your entire body at risk. Let's break down what's going on step by step. Plaque forms because of bacteria feeding on leftover food in your mouth. When not removed, plaque hardens into tartar in as little as 48 hours. Tartar damages your gums, causing them to pull back, and creates pockets where bacteria invade deeper tissues. Over time, bacteria-triggered inflammation starts destroying both gum and bone structures. Think of it like a domino effect. One small step, skipping brushing, leads to a cascade of issues you might not even notice until it's too late. Preventing this is easier than solving it. Okay, so we've talked about the science, but let's get real. How does this affect your everyday life? Social embarrassment. Imagine struggling with chronic bad breath that no mint can fix. You'd feel hesitant to get close to others or speak with confidence. Painful dental problems. Cavities and gum infections aren't just unpleasant. They can make simple activities like eating or talking painful. Big financial costs. Fixing severe damage isn't cheap. Root planing, scaling, tooth removal, implants, it adds up fast. Without a healthy mouth, your quality of life takes a big hit. But here's some good news. It's 100% preventable. If all of this sounds scary, don't worry, there's a simple solution. Basic oral hygiene practices like brushing, flossing, and regular dental cleanings can protect you from all of this. It's that easy. Here's how preventative care works. Daily brushing and flossing cleans away plaque before it hardens into tartar. It's like hitting a reset button twice a day. Routine dental cleanings, even if you're diligent at home, some tartar will still form. A professional cleaning every 6 months keeps things under control. Early detection. Visiting the dentist regularly prevents small problems from becoming big ones. Think of these habits as an investment in your smile and your overall health. Ready to take charge of your oral health? Here are some simple but powerful steps. Brush twice a day with fluoride toothpaste. Floss daily to remove plaque from between your teeth. Drink water after meals to rinse away food particles. Visit your dentist for a professional cleaning at least every 6 months. It's never too late to start. If it's been a while since your last appointment, don't be embarrassed. Your dentist is there to help, not judge. So, would you risk your smile by skipping cleaning for a year? I think we can all agree, it's just not worth it. Your teeth are with you for life. Treat them well and they'll reward you with confidence, good health, and zero regrets. If you found this video eye-opening, don't keep it to yourself. Share it with a friend. You might just inspire someone to take better care of their smile. And don't forget to hit like and leave a comment. What surprised you the most? See you at your next dental cleaning. And remember, your smile deserves nothing less than the best care.